I'm going to talk about the oral immunotherapy for the treatment of egg allergy in children. Okay, this is a new research has proven the effectiveness of the method of combating egg allergy, but for now it is laboratory experience that cannot yet be applied to all the people. The definition of allergy. An allergy is a reaction of the immune system of the body to common substances which generally do not cause problems for most people.
So egg allergy is where your body has a protein called IgE that incorrectly assumes that egg is a bad protein. And so it causes a reaction which releases histamine in the body and can cause hives, wheezing, shortness of breath when you're exposed to egg. So anytime you suspect a food allergy, you should see an allergist. Just going on your history of what you've eaten, you may not know exactly what you've been exposed to. So an allergist is specially trained to look into what you've been exposed to and then can do testing in the office to help you determine what you're allergic to. If you have an egg allergy, all vaccines are safe to receive from your primary care doctor except for influenza and yellow fever. So if you want either of those two vaccines, you should see your allergist, who can still give them to you safely, but it should be done under certain conditions.
The immunotherapy, refers to the set of strategies for treatment of stimulate or restore the immune system against cancers, infections, or other diseases.
Cancer can result from a breakdown in the immune system. Immunotherapy is designed to boost the immune system, supporting the body's fight against the disease. Immunotherapy works differently than other cancer treatments, such as surgery, radiation, and drug therapy. To understand immunotherapy, it helps to know how the immune system fights cancer. Cancer cells have substances on their surfaces that raise an alarm in the immune system that cancer is present. These substances are called tumor antigens. Immune cells, called antigen-presenting cells, or APCs, roam the body, seeking out and ingesting tumor antigens. The APCs then activate two other key immune cells, B cells and T cells. When activated by an APC, B cells become plasma cells that make antibodies. These antibodies may mark tumor cells for elimination. T cells are the body's most powerful cancer cell killers. When activated by APCs, T cells multiply, seek out, and destroy cancer cells bearing the specific tumor antigen. APCs also recruit other cancer-killing cells, including natural killer cells. The immune system's army of APCs, T cells, B cells, and natural killer cells interacting with the tumor antigens are the core components of the immune response that works to eliminate cancer cells. But the immune response can't always destroy all the cancer cells. For a time, an equilibrium is reached where the tumor can be contained but not eliminated. As the tumor mutates, it evades and suppresses the immune response, allowing cancer cells to escape the immune system and spread throughout the body. The goal of immunotherapy is to tip the scales back in favor of the immune system, empowering it to eliminate or contain the cancer.
Okay, in this study, is if about a double-blind, randomized, placebo-controlled study, 55 children, 5 to 11 years of age, with egg allergy received oral immunotherapy, 40 children, or placebo, 15 children. After 10 months, more than half of the children who had received oral immunotherapy passed the test of consuming 5 grams of egg white powder and were considered desensitized. It was not the same with those who received placebo.
Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. A new report published in the New England Journal of Medicine finds that exposing children with egg allergies to very small doses of eggs over an extended period of time may reduce or even eliminate their allergic reactions. Here are some symptoms of food allergies. Skin symptoms including hives, angioedema, and itchy red rashes. Respiratory symptoms including cough, wheezing, and throat swelling. And GI symptoms including severe abdominal pain with vomiting or diarrhea. Researchers from the University of North Carolina studied 55 children who were allergic to eggs, randomizing 40 to oral immunotherapy and 15 to placebo for 10 months. The oral immunotherapy consisted of very small daily amounts of powdered egg whites, with the amount gradually increasing every 2 weeks. Children were followed for up to 3 years, periodically taking food challenges to assess their sensitivity. After 10 months, 55% of children taking oral immunotherapy were able to eat 5 grams of egg white, passing their food challenge, compared to none of those taking placebo. After 22 months, 75% of children in the oral immunotherapy group passed a food challenge of 10 grams of egg white. To test if this newfound tolerance would take, researchers then told the children who passed the second test to avoid eating eggs altogether for 4 to 6 weeks, afterwards allowing the children to resume eating eggs. Results showed that 28% of these children were able to eat eggs with no symptoms at all. We had a chance to speak with Dr. Wesley Burks, principal investigator of this study, who offered some further insight.
The main 2 messages are that the study shows that we can work with older egg allergic children, and with the process that was developed, that about a third of children treated after 2 years were able to put eggs back in their diet and eat them without any allergic symptoms. So that helps us that we know in the future that a treatment can be developed. But really the other message is that this is really the middle step in a 3-step process that gets something actually into the clinic, that the next series of studies need to be aimed at understanding the safety better, understanding how long the treatment needs to take place, and then more specifically about which patients would be better suited than others. It's really not ready to be done yet. We literally started at 1/10,000th of an egg, and that's something that's really not practical and could easily cause too many allergic reactions if done inappropriately.
Today's research demonstrates that sensitizing children with food allergies to food they are allergic to has potential to reduce or even eliminate their allergic reactions. The authors emphasize, however, that this testing was done in a very controlled setting and with a very small amount of eggs and should not be attempted at home. For Insider Medicine in Depth, I'm Dr. Susan Sharma.